Hello, my name is Denis-Cătălin. In this conference, I will make a short presentation of the paper entitled, The Impact on Community Mobility During the Pandemic Crisis in Romania. The presentation will take place according to the table of contents. Research context. The technological evolution of the last years cumulated with the development in the field of mobile devices, such as smartphones, has generated profound changes in the economy, but also in society. Increasing the availability of mobile devices has led to the generation of large packets of data on user behavior. In the fight against the COVID-19 pandemic, anonymized aggregate data on population movement began to be made public by giants Google, Apple, and Waze in reports showing mobility trends on driving or pedestrian movements. Main research goal. In the current epidemic context, mobility-related data can be valuable sources to be used in measuring the application of social distancing restrictions, but also for developing the resilience of communities to cope and learn based on the response of the population to the various waves of the pandemic. The data were tracked for the period before the national lockdown in Romania, during the state of emergency and during the state of alert. Descriptive statistics were applied, represented in various diagrams, such as box plot type diagrams, heap stream representations. Also, correlation and regression analysis was performed to test the existence and strength of the linear relation between the variables represented by mobility data and those related to SARS-CoV-2 virus infection obtained from official statistics. Research methodology. For developing this paper, were identified data sources such as Google Mobility Reports, Apple Mobility Reports, Waze Mobility Reports, and COVID-19 infection statistics for a quantitative analysis. Python was used to automate data extraction. The data were cleaned and formatted unitary to create relations between the data tables. Each data set was stored in a relational database. Then, the data were visually represented and analyzed with Power BI, including Python script sequences. The workflow is depicted in this representation. Main research findings. The analysis was performed over 3 intervals, called before lockdown period until the launch of the lockdown measure in Romania in response to the first cases of COVID-19 infection. The next analyzed were the state of emergency 1 and the state of alert period. Were used to box plot analysis to visualize modifications in the mobility at the level of the 6 categories: retail and recreation, grocery and pharmacy, parks, transit stations, workplaces, residential. Dividing data on the 3 periods, it is observed that during the state of emergency, mobility decreased considerably. On the first 5 categories, and the stay in the residential locations registered a significant increase. Romanians' visits to malls and for recreational purposes decreased significantly during the second period, also the traffic at bus, subway, or train stations. During the restrictions, walks in the parks were forbidden, schools and non-essential workplace was closed, and also being cancelled public gatherings and events. The number of kilometers spent by Waze users' travels is observed to be greatly diminished in the state of emergency period, as depicted in the representation. A similar thing can be observed from the analysis of Apple data, pedestrian mobility being affected even more than driving by personal cars. To visualize and compare the trend of community mobility change for each state and at the city and country level, were used a heat map representation, where the data are represented on the x-axis, time, and y-axis. City and country colors and shades of brown indicate reduced mobility for Google, Waze, and Apple data. Shades of black indicate higher mobility. From the analysis, it can be seen that at the time of imposing restrictions, state of emergency, mobility is reduced. To observe the relationship between the data being studied, was performed the correlation analysis. The correlation is different during diverse time spans, being also influenced by other factors not included in the analysis, such as wearing masks, physical distance, testing capacity, or occurrence of new infection strains. To determine the intensity between the analyzed variables, example dependent variable, Google Workplace, and the independent one, Google Residential, the level of correlation between them is established. Following the calculation for the selected example, the resulting Pearson correlation coefficient is -0.87. So between staying home and going to work there is a strong negative relationship. There is a positive correlation between change in each category of Google mobility, less between residential and the other categories, between which there is a negative correlation. The Waze and Apple data are also positively correlated, one with each other and with 5 Google categories, only being negatively correlated with Google residential mobility. It can be said that with each unit of Google's residential mobility increased, more precisely the stayed at home, there is a decrease by -0.34 units of the mobility at workspaces. When the number of COVID-19 infections increases by 1 unit, there is an 8.74 units change in mobility in parks. With each unit of Google retail and recreation mobility increased, there is an increase of 0.47 units in number of kilometers traveled by Waze users. Conclusion. The paper aimed to explore the situation of people mobility and the evolution of COVID-19 infection cases, considering the restrictive policies imposed, either at a community or national level. Data of this type, correlated with other relevant sources, can help predict new epidemic waves in planning urban and transit infrastructure and understanding mobility for developing community resilience. Thank you for your attention. For more details about the study, please go to 37th IBIMA Conference Proceedings.